Now, today we'll be talking about the medicine pioglitazone. Now, we must know this pioglitazone is an oral hypoglycemic agent or oral hypoglycemic drug. This falls under thiazolidinediones class, and this actually has a is a very selective agonist for nuclear peroxisome proliferator activated receptor gamma. In short, it is a selective agonist for PPAR gamma. Now, what is the need of this PPRA gamma? Actually, this is mainly found in fat cells, muscles, and what actually it does is it enhances the transcription of several insulin responsive genes. What does that mean? It simply enhances the GLUT4 expression and translocation of the GLUT4 expression on these fat cells as well as in the muscle cells, so that the glucose is very effectively taken up by the fat cells or muscle cells. So this is how it reverses the insulin resistance. That is the reason why it is one of the excellent insulin sensitizer. It means ki it will help us to reduce the need of the insulin to the patient. So even at lower insulin level, the patient's sugar can be managed better. So, uh, as what I just told, that it enhances GLUT4 expression on these fat cells and muscle cells. So, glucose entry into the fat and muscle is improved. There is how the insulin requirement to move this glucose into fat and muscle is reduced. That is the reason why it causes sensitization of the insulin glucose body. It also reduces the hepatic gluconeogenesis. That is how new or extra glucose formation significantly reduces. So it will automatically reduce the glucose burden. The lipolysis, that is the lysis of the fat and plasma fatty acid levels, is reduced. But the adipocyte, that is fat cells turnover and differentiation, is accelerated by this pioglitazone. On cholesterol, what it actually does is it lowers serum triglycerides, it increases HDL, and it doesn't affect LDL. That is the reason why this pioglitazone has the few beautiful thing is it will increase the insulin sensitivity, it will mobilize the fat, and it will have a positive impact on fat concept, like it will lower the triglyceride, it will not affect LDL much, but it will increase the HDL, that is high density lipoprotein, which is very much essential to reduce the cardiac problems or to reduce the cardiac events. The adverse effect of this pioglitazone is it causes plasma volume expansion. That is the reason why it is not a good option in congestive cardiac failure. That is the reason why it is not a drug of choice for those patients who have low EF, those patients who have recurrent hospitalizations. We usually doesn't advise such patients to be put on this pioglitazone. It very commonly causes edema, weight gain. That is the reason why it is not a good drug for those patients with diabetes who have heart failure or who have recurrent hospitalization, or those patients who already have edema, or those who are obese. Very rarely, it can also cause hepatic dysfunction. That is the reason why it is contraindicated in liver disease as well as in congestive heart failure, because it may markedly increase the risk of congestive heart failure. One more thing that we must remember is it increases the risk of fracture, especially in elderly. That is the reason why it should be used very cautiously in patients with more than 60 to 65 years of age. Another problem with this pioglitazone is there can be a failure of oral contraceptive with the use of this pioglitazone. So additional precautions like barrier or condom contraceptive must be used whenever a young or childbearing person or patient is using this pioglitazone. For HbA1c reduction, it can give us HbA1c reduction of zero point 0.5 to up to 1.2%. And the risk of occurrence of fluid retention, weight gain is there, and this risk can actually be markedly increased if it is specially used with insulin. So using pioglitazone with insulin is has to be used very cautiously, especially in those patients who have high risk of congestive heart failure, or those patients who have recurrent hospitalization, or those patients who are obese. In such patients, ideally, these two drugs should not be used together. This drug is not at all for indicated or recommended for type 1 diabetes, and this drug is not at all indicated or recommended in pregnancy as well. Thank you. The usual dose of this pioglitazone, it comes into combination. This drug can be used as a triple drug therapy. So it is very commonly associated with glimepiride plus metformin plus pioglitazone. You can get this combination. So if someone is on dual combination like glimepiride plus metformin, you can simply add on the pioglitazone into it. It comes into 50 milligram tablet or 7.5 milligram tablet. It can be given twice very commonly. Up to 30 milligram is very commonly used. More than that, it is not usually recommended, or more than that is not usually commonly used by most of the clinicians. So thank you.